stress is a big part of life today. Everybody complains about stress. Does stress contribute to acidity, or is that a myth?
I think there's a both direct and an indirect correlation to stress. Stress itself, say supposing you're anxious, you do feel a knot in your stomach, isn't it? Part of it is contributed to an increased acid secretion. So stress leads you to bad habits, eating junk, consuming alcohol, smoking. All this is part of stress, or what we think as something which can alleviate the stress. But it unfortunately contributes to increasing acidity in your stomach.
Welcome to Health Inside Out, a Kauvery podcast.
You're tuning to Fever 104 FM. This is Cheyenne on the Superhero Show, and it's a Thursday, and every Thursday on the show, we've got Health Waves by Kauvery Hospital. Marathali, a doctor, joins us on the show, and today we've got Dr. Deepak Ganga here in the studio with us. Sir, thank you so much for taking time out and coming to our studio today.
Thank you so much.
Sir, if you could kindly introduce yourself once for our listeners before we go ahead and talk.
Well, I'm Dr. Deepak Ganga. I'm a consultant medical gastroenterologist, hepatologist, and interventional endoscopist.
All right, sir. Thank you so much once again for coming to our studio. We will talk about acidity. We will talk about heartburn. These are issues that plague a lot of people. Do you think that acidity and heartburn is a little more common nowadays than, let's say, 30, 40 years ago, what our parents and grandparents faced?
Yeah, most definitely. I think a lot has to do with the lifestyle. If you look at our grandparents, they lived a much simpler and traditional life. They also used to consume freshly cooked food.
Right.
I think that makes a lot of difference. They also, their lifestyle was much better. They included a lot more physical activity, less stress, good sleep. I think all those things are questionable now,
Right.
in majority of the people. So yes, to a large extent, we would say that there is a definite increase in acidity and heartburn issues of late.
All right. We often skip meals, a lot of us tend to eat late or, grab these quick snacks. Do these everyday habits contribute to problem like acidity or reflux?
Everything has a rhythm.
Okay.
So does digestive system. So I think to maintain the rhythm, possibly meals on time make a difference. But taking a quick grab is always a problem because most of these fast foods, they have refined sugars, bad fats. And they have additional synthetic additives. So these can, cause irritation of the lining of the stomach and cause all these heartburns or acidity.
Can you explain, and as simply as you can probably, what heartburn is?
So heartburn is basically whenever you eat, after some time, you start having a burning sensation behind your chest, the chest wall.
Right.
That is what we usually call as a heartburn. And this is usually seen after a particularly heavy meal or a fatty meal.
Okay. And what happens that causes that?
Basically, it's the acid coming back into your food pipe. You should not be getting acid reflux, as in the acid which is produced in your stomach should not come back into your food pipe. So whenever you get it in the food pipe is a little sensitive. So you have this burning sensation.
All right. Yeah? But can you tell me why would that acid reflux happen? Let's say I've had a heavy meal. What makes that acid go up that food pipe again?
See, what happens is between the food pipe and the stomach, there's a valve, right, which prevents, it's like a one-way valve. Once the food goes into the stomach, it's not supposed to allow either the food or the acid to come back.
Okay.
So this valve in certain people, in certain individuals, is a little loose, right? And the second thing is whenever we have an heavy meal, the stomach can only accommodate so much, right? So, and if you are having a fatty meal, the valve tends to relax a little bit more. And allows the acid or the food to come back into your food pipe, and that can cause this heartburn.
Okay, but is that something that is, you said in some people the valve is a little loose.
Yeah.
Is that genetically, or is that a condition that you give rise to with the food that we eat?
No, that is not related to food per se. And I wouldn't say it's genetic as well. It's just that some individuals have for whatever reasons. Right? And the biggest contributor for that sometimes is obesity. Being a little bit on the heavier side can cause the valve to be a little bit more looser.
Okay, all right. Now, when people feel heartburn and they lie down, that makes it worse. Yeah. Why does it happen? What can you do to avoid this?
Again, the same concept, right? The food or the acid should not be coming back into your food pipe. Gravity has to play a huge role in this, right? When you're standing up, it's not that easy for it to come back into the food pipe. So when you lie down after a heavy meal, just think about it, the valve is loose, right? So the acid or the food can very easily come back into the food pipe.
Okay.
And that causes the heartburn, especially when you lie down.
All right. Stress is a big part of life today. Everybody complains about stress. Does stress contribute to acidity, or is that's a myth?
I think there's a both direct and an indirect correlation to stress. Stress itself, say supposing you're anxious, you do feel a knot in your stomach, isn't it? And part of it is contributed to increased acid secretion. Right? Also, stress leads you to bad habits. Okay, what I mean by bad habits, eating junk,
Right.
eating spicy food, or consuming alcohol, smoking. All this is part of stress, or what we think as something which can alleviate the stress, but it unfortunately contributes to increasing acidity in your stomach.
So let's say, for example, if I am an individual who doesn't feel too stressed out in life.
Yeah.
However, my eating habits are not that great. Let's say I consume a lot of fast food or these snacks. So will that contribute to stress in my body?
Yes, we have something called as gut-brain axis. I think now it's
What is it? Gut-brain axis?
Gut-brain axis, yeah.
Okay.
So I think a lot of research is now going on that aspect of it. Definitely, there's a role to play with not having good habits with stress, and the vice versa as well.
Quite a bit about these two. But can you tell me, when do common problems like acidity and heartburn turn into something more serious, and how can someone spot the difference?
So we have something called as alarm signs or red flag signs.
Okay.
We're always concerned when these pop up. One is if, say, an elderly person comes with these symptoms
Right.
firsthand, then we say you need to be worried, we need to investigate further.
Okay.
Other common symptoms which we are very concerned is when they're having difficulty in swallowing either food or water, right? Or if they have something called as low hemoglobin or anemia.
Okay.
If they have family history of any cancers, and even if after taking medications they're not at all improving, then we are always concerned, and then we prescribe additional tests then.
All right. And, many people treat this as a common problem. When they feel discomfort, they pop in antacids. Are there any risks to relying on these antacids too much?
Well, long-term antacids for one can cause kidney issues, can cause bone issues.
Right.
They can also cause increased infections. Most importantly, we may not understand why the person is having the symptoms.
Right.
What is the one which is causing the problem? So we need to address the problem first. So we need to find out what the problem is, and then probably ask them to take these medications.
So what treatments are available for chronic issues like acid reflux?
Well, there are definitely more treatment available, especially if lifestyle modifications and medications don't work.
Okay.
Right? We always try to manage the patient's medications, but if the patient requires medications for long term, and they're concerned about side effects of these medications, if they're concerned that they don't want to take it for a long term, then we always offer surgeries. Now, surgeries can be two types. Either they're endoscopic surgeries, that where we put a camera in and try to manage within that, or there are other laparoscopic surgeries which we can recommend on a patient or a case-to-case basis.
All right. And finally, for people listening in, gut health has come into a lot more focus in the last couple of years, is what I've realized. Right? How can we take better care of our gut? If there is one advice that you want to give people, I know healthy food is one thing you would mention, doctor,
Yes.
and that's there. But most of us are not able to eat healthy all the time. So what else should we consume? Should we do to keep our gut healthy?
So, gut health has
Right.
two components to it.
Okay.
Or basically, it's diet and exercise. Diet you already mentioned, that healthy food, avoiding alcohol, smoking, all that makes a difference. The second most important thing is exercise. I think having a good exercise, at least 3 or 4 days in a week, around 30 minutes a day, should go a long way in improving your gut health as well.
Okay.
Yeah.
Okay. All right. And a lot of people, let's say, tell people to consume curd and take in all these probiotics that are available by different brands. We'll not take the name of any brand, but what
Yeah.
is your take on that?
By all means, I think curd and all those things can be taken.
Right.
For certain section of population, maybe avoiding dairy products will help.
Right.
As far as probiotics is concerned, there's no real scientific evidence that consuming probiotics kind of alter your gut microbiome and therefore improves your health. There's still no solid data on that. So till that time comes, maybe just having good healthy food is more than enough.
All right, Dr. Deepak Ganga, thank you so much for taking time out and speaking to us about acidity, about heartburn, about gut health. This has really educated quite a few of us on things we knew nothing about, for that matter. So thank you so much. I would love to see you in the studio very soon again.
Thank you so much.
Thank you, sir.